we've got our Deputy Director of Public Health, Geoff Barnes, in the hot seat this week. How are you doing, Geoff? You all right?
I'm okay, thanks, Royce.
Very good. So we'll start off with a nice, gentle question then. What's the general feeling out there? How is our area doing? How is it performing compared to the rest of the UK? How are we doing?
It's encouraging, I think. Certainly at the moment, North East Lincolnshire looks like it has the lowest rate of upper tier authorities in England. And that's a very different place than we were, say, back in mid-November when we were close to the highest. So we've come a long way in the last couple of months. Our rate now is getting down towards 100 per 100,000 per week. Had been at one point up at 600, so we've certainly come a long way. Where I want to see us is down well below 100, getting down towards 20 per 100,000, which is where we were up until around September time. So we've still got a way to go. So all the kind of messages still apply: the importance of social distancing, etc., the importance of hand-face space, really important. We do still have a lot of people in our local hospitals being treated for COVID-related illness. A lot less than a month ago, but we're still talking over 40 people in our local in Grimsby Hospital being treated with COVID. So there's still a lot of pressure out there. It doesn't take very much to push things really back in the wrong direction, as some places found. During December, some places which saw their rates absolutely escalate enormously in the space of 2 or 3 weeks, and that's what can happen in these kind of winter conditions, where these kind of viruses can spread enormously quickly. But obviously, I feel that people in North East Lincolnshire are really acting responsibly. Otherwise, we wouldn't be in this improving position. But the message is still, we need to continue this for certainly the next couple of months until the kind of better conditions arrive, which hopefully at that point will enable us to move away from these kind of restrictions in our lives.
Okay, that's good. It's positive to hear that we're doing okay and we've improved from where we were before Christmas. I think vaccines are the big thing in the news at the moment. Obviously, we now have, I think in the UK, 3 vaccines that have been approved for use. So we know that people in our area are now receiving the vaccine. The government have given the go-ahead to proceed with vaccinating over 70-year-olds as well now. So what can you tell us about the vaccination programme in our area?
I can say we've made a fantastic start. Our local GPs and our CCG is doing a fantastic job getting the vaccination out. We've covered most of the over 80s so far. We've covered most care home residents. We're rolling it out across many people working in the health and social care sector. So we're well on track, we feel, to reach the government target to have all those groups receiving their first dose by the middle of February. It seemed an enormously tough target at first, but the real commitment and a fantastic delivery is ensured. We're well on the way to doing that. Then it's, as you say, Royce, it's then moving down the kind of identified cohort. So initially down to the over 70s, who will begin to start to be invited over the next few days, very likely, and then moving on to other groups such as the over 60s and the over 50s and younger people with health issues which make them at risk. The intention being that by early April, all those groups will have received at least the first dose of the vaccination, which is an awful lot of people to have been covered in the space of 3 months, and really, as I've said in the past, by far the biggest vaccination programme that we've ever run in this country and in our area. So a really fantastic start so far. Key to moving forwards is ensuring that delivery of those vaccine supplies come through. The initial main vaccine was the Pfizer vaccine, which was a bit difficult to manage. It had to be stored in particular ways, but with the supplies increasingly of the AstraZeneca vaccine, which is more easy to manage. So ensuring that regular delivery and should be much more manageable. So Yeah, a really positive start, and I think I'm enormously encouraged about our ability to vaccinate all these top 10 cohorts by April.
That's great to hear, and I suppose as well, thanks goes out to those healthcare staff that are coming in and carrying out that program, making it happen. Without them,
we have a lot of volunteers as well who've signed up to assist in the program, helping out as well. I think I heard today something like 200 people have volunteered in North East Links to assist with that. So enormous thanks to them as well.
That's incredible, really incredible. And almost hand in hand with vaccines then, I know testing is still being talked about, and I know the advice before was if you know any sign of a symptom and you get yourself tested. Is that the case, and is there any other general advice that you want to issue?
Nothing's changed essentially. So if you've any of the kind of 3 classic symptoms, the persistent cough, the temperature, the loss of taste and smell, please book a test. There's a lot of capacity out there. We've now got, as well as our Dutchess Street testing centre, we've got mobile centres operating in Cleethorpes and Immingham. We got home testing. We've got enormous capacity out there. So anyone who needs a test should be quickly able to get a test now. And it certainly helps in controlling this virus if we can quickly identify who's positive and then provide the advice to self-isolate, both for the people who have the virus, but also for their contacts as well. Self-isolation of cases and contacts is absolutely vital to controlling this virus. If people don't follow that advice, then before you know it, we can be having substantial outbreak situations, and we've seen it in many different types of location over the last few months, and all too often it's because somebody didn't act on the symptoms, didn't get tested, or their contacts thought they were okay to carry on, even though they knew they were a contact. So it's just so important to get tested, find out whether you're positive, and ensure that your contacts self-isolate for those 10 days.
Okay, Geoff, thank you for your time.
Thank you, Wish.